to the eye or its surrounding structures. It can range from minor injuries like corneal abrasions to severe damage that can lead to permanent vision loss. Here's a comprehensive overview of ocular trauma. Types of ocular trauma. 1. Blunt trauma. Causes: commonly caused by sports injuries, car accidents, or assaults, e.g., a punch or a ball hitting the eye. Symptoms: pain, bruising around the eye, periorbital ecchymosis or black eye, swelling, decreased vision, or double vision. Potential complications: orbital fracture, a fracture of the bones surrounding the eye which can lead to entrapment of eye muscles. Hyphema, blood in the anterior chamber of the eye which can increase intraocular pressure. Retinal detachment, the retina can detach from the underlying tissue leading to vision loss. Vitreous hemorrhage, bleeding into the vitreous humor can cause floaters or visual disturbances. 2. Penetrating trauma. Causes: injuries caused by sharp objects like knives, scissors, or glass fragments, or high-velocity projectiles like bullets. Symptoms: severe pain, vision loss, visible wound, or leakage of eye contents, prolapse of intraocular tissue. Potential complications: open globe injury, a full-thickness wound of the eye wall, sclera, or cornea. Endophthalmitis, a severe intraocular infection that can follow penetrating injuries. Retained intraocular foreign body, objects like metal or glass fragments may remain in the eye, requiring surgical removal. 3. Chemical burns. Causes: exposure to acids, alkalis, or other toxic chemicals, often from workplace accidents or household cleaning products. Symptoms: intense pain, redness, tearing, blurred vision, and in severe cases, whitening of the eye, sclerotic scatter. Potential complications: corneal ulcers, ulceration and scarring of the cornea, leading to vision impairment. Limbal stem cell deficiency, loss of corneal clarity and severe vision loss due to damage to the stem cells that regenerate the corneal epithelium. Symbolpharon, adhesions between the eyelid and the eyeball. 4. Radiation injury. Causes: ultraviolet light exposure, e.g., welding without proper eye protection, excessive sun exposure, or ionizing radiation. Symptoms: pain, photophobia, tearing, and in severe cases, cataracts or retinal damage. Potential complications: photokeratitis, sunburn of the cornea, commonly known as snow blindness or welder's flash. Cataracts, opacification of the lens leading to vision loss, often seen with prolonged exposure to UV radiation. Diagnosis and management. 1. Initial assessment. Determine the mechanism of injury, time of onset, and symptoms. Visual acuity. Check the patient's ability to see and record it as a baseline. Inspection. Examine the eye for foreign bodies, lacerations, swelling, and any abnormalities. Pupil response. Check for afferent pupillary defects or irregular pupils, which could indicate serious internal damage. Slit lamp examination. A detailed examination of the eye's anterior segment. Intraocular pressure measurement. High pressure might suggest a closed globe injury, while low pressure might indicate an open globe injury. 2. Imaging. Orbital X-ray or CT scan. Useful for detecting fractures, foreign bodies, and assessing the extent of internal injury. B-scan ultrasound. Used if the view of the retina is obscured, e.g., by vitreous hemorrhage, to check for retinal detachment. 3. Eye shielding. Protect the eye from further damage by using a rigid shield, especially in penetrating trauma. Irrigation. For chemical burns, immediately and copiously irrigate the eye with sterile saline or water to dilute and remove the chemical. Tetanus prophylaxis. Administer tetanus vaccine if the injury is penetrating or involves contamination. Antibiotics. Topical or systemic antibiotics to prevent infection, particularly in open globe injuries. Pain management. Use of analgesics and sometimes sedatives to control pain. 4. Surgical intervention. Repair of open globe injuries. Urgent surgical intervention to close the wound and restore the structural integrity of the eye. Removal of foreign bodies. Surgery to remove intraocular foreign bodies, often done in conjunction with vitrectomy. Management of retinal detachment. Procedures like scleral buckling or vitrectomy to reattach the retina. 5. Follow-up care. Monitoring for complications. Regular follow-up is essential to detect and manage complications like glaucoma, cataract formation, or infection. Rehabilitation, vision therapy, low vision aids, and psychological support may be necessary for patients with permanent vision impairment. Prevention, protective eyewear, use of safety goggles in high risk environments, e.g., construction, laboratories, sports, is critical. Education, raising awareness about the risks and first aid measures for ocular trauma. Workplace safety regulations, ensuring that appropriate safety protocols are followed in hazardous occupations. Conclusion, ocular trauma can lead to significant and sometimes irreversible vision loss. Prompt recognition, appropriate management, and preventive measures are essential to preserving vision and preventing complications. Early referral to an ophthalmologist is often necessary, especially in severe or complex cases.